Hey everybody, how you doing? Dr. Frank DeLolo. Thank you for tuning in. Today, usually on Wednesdays, you know that we do celebrating patients' results, all right? I'm here with Jake, and I am going to do it with him today. Margaret usually does it for me, but Jake's story is a bit unique. And one of the things I want to drive home with his story today, and he'll share it in just a second, which is that yes, people can in fact still get adjusted even after they have, let's say, neck surgery. We'll talk about Jake's situation in just a second. But yes, you can get adjusted. People usually ask that question, you know, if I have screws and plates in my neck or my back, can I still get adjusted? And the answer is yes, and he's living proof. So I know Jake for a long time, longer than I'd like to even really mention, because I am older than him. I will say that I'm older than him. You graduated with my sister, yeah?
I did.
Yeah, he actually graduated with my younger sister. So anyways, so I know Jake since we are both kids. He was more of a kid than I was. But now we have reconnected later on as adults. Our kids play sports together, and we've coached lacrosse together as well. Yep. So we got reconnected, reunited, and he's gotten some pretty decent results. I'll let him share more of that in just a sec. But so that's why today's purpose, and hopefully his story is going to help somebody out there. So welcome and thank you for doing this.
Thanks for having me, Doctor.
Number two, let's talk about where you were prior to you seeing me and meeting up on the lacrosse field and saying, hey, you know, I had this thing and I got this surgery and this is what was going on with me and I was unable to do these things before my surgery.
Mm-hmm. Yeah, so I actually had an accident, almost probably 13, 14 years ago, which resulted in chronic neck pain with significant flare-ups on probably a biannual basis. And then finally in 2015, I had an event which led to significant atrophy in my left arm. Pain, typical events were maybe 2 to 3 weeks in duration. This was something that was more about 6 to 8 weeks in duration. The pain continued on, the atrophy continued on, and I came to a point where I had to decide, at least from a recommendation standpoint, whether I wanted to go in and fix it surgically or continue to address it with more in your therapeutic approach versus something was a little bit more aggressive in the surgery space. Since I was getting to a point where atrophy was getting significant and I didn't want it to be lasting, I did go in and get C5, 6, and 7 fused, and that was in May of 2015. That relieved the pain. I still had significant atrophy, and obviously had some a nerve damage.
For those of you who don't know, atrophy is, maybe you know, maybe you don't know, but if you don't know, muscle atrophy is like his muscles got smaller, like they shrunk.
Mm-hmm.
Yes.
Significant in the left arm from the right arm.
You're almost symmetrical now, no? Almost?
Getting there.
Yeah.
But it's building back up over the course of time. So that was May of 2015. Dr. Frank and I ran into each other. At the same time, I was also getting significant pain in lumbar region.
That's right.
And which was affecting, as a former athlete and somebody who's active most of the time, was affecting all of my activities: golf, skiing, surfing, and everything else that I enjoy.
Collegiate athlete.
Yes.
Yep.
So when I ran into Dr. Frank and started being treated in September of 2015.
Man, you're good with the dates.
Yeah, not bad. Good memory. Well, I've been very active for the last 3 years, so it's easy to remember what the dates are. And then on a routine basis, so I think I'm not that great with dates, but I saw Dr. Frank on a very consistent basis for probably the first, I would say, 8 to 12 weeks.
Yeah.
And saw very good progress. Started to make considerable gains in the atrophy space, and from a mobility standpoint as well. And then I've stuck with it on I'll say a preventive schedule. So probably I'd say every other week. And if something flares up, if there's a stressful situation, I travel a lot for work. So if I find myself stuck on an airplane, often for long flights, I'll sometimes ramp it up a little bit. But here we are, 3 years later after starting treatment, and I'm not limited in any way. I'm back to playing some pretty good golf and staying involved in all of my other activities as well. So definitely a testament to the treatment I've gotten and continue to receive, and looking forward to staying on the straight and narrow.
So if I remember correctly, the workouts, you were doing no workouts, I think, when I first met you because you didn't feel like you were able to.
Correct. I was very limited limited in workouts. I mean, I've tried to stay active, but I tried to stay active as I guess a form of therapy, but I was very limited in what I could do.
And then, if I remember correctly, you were doing some of the workouts we were talking about on a DVD video, and we were doing like pretty high intensity stuff.
High intensity HIIT workouts.
Yeah. You know, high intensity interval training like push-ups and jump squats and you know, those types of things. So pretty like intense stuff where he wasn't doing any and then felt good enough to in fact do that. So would you say that the reason why you continue for what is the reason why you even come back for adjustments? I know you mentioned it just earlier, but is it preventative for you? Do you just feel good? What is it for you?
Well, I think it's one, I certainly feel better. Two, it's preventive, and three, there's you know, other areas where I think you know, either directly or peripherally have been affected as well by having regular adjustments. Sleep has gotten better, and I say mainly sleep. But between sleep and the mobility and the activity level that I'm able to maintain, which is why I stick with the preventive schedule.
Cool. Hopefully that story helps someone out there. Again, he has C5 to 7. That's the 5th bone to the 7th bone is fused, right? Got that done. It did the trick. It did what it needed to do. And now we're still doing adjustments with him, and he's able to live his active lifestyle. Paddleboarding, stand-up paddleboarding, surfing, skiing, golf, right? So
exercise.
It's possible. So thank you so much for being here and telling your story. I hope that helps somebody. Until next time, I'm Dr. Frank DeLolo. Go out and be your best self.